with Dr. Woodley Wednesday, where we come live and answer your questions.
And we're all COVID free.
And we're all COVID free. For those of you guys that have been following us for a while, you know that Dr. Katie has agreed with her, just so generously agreed with her schedule to come live with us once a month. And last month, she had
that was day one that you all experienced. So I made it.
Right. It was the next day that you sent us the
yeah, I was like, there it is. We're positive. And I made it. So we made it.
Yes. You were remarkable. I have to say, I don't know. I tried to sit through a meeting when I was not feeling well, and it was painful. So
I was a little sweaty from the fever, but it was okay. We made it. So
you were, man, you powered through. You never would have known. Never would have known. That's remarkable.
No, you're a badass.
Hey, Dana, Anna, Aaron. Pam is here. Madison, a shout out to you, my dear lady.
Oh, Madison. Oh, I love seeing you here.
Look at this girl. Madison sent us these beautiful I work hard so my cat can have a better life.
Sorry, I can't. I have plans with my cat.
Right?
Aww. So this is to Madison and to Tina for the 1,200 stars.
All your stars.
Cheers.
To Mission Meow, y'all. It is going to
Mission Meow is a 501c3 that is helping 501c3s. So Mission Meow is an absolute genius organization created to help build more funds for small cat rescues, small cat nonprofits. So all cat centric. It's absolutely beautiful. And all of your stars are going straight to Mission Meow.
And Rob is here. Good evening to you, good sir. Angela, oh my gosh, I'm so excited. So before you guys get your questions ready, I'm so excited about this. Katie, I was thinking about the fact that, it's so, anytime that we go to the vet's office and we've got questions, right? We load up on questions to ask, like, ooh, hey, is this normal? Ooh, hey, I noticed that, whatever. And it always feels like so rushed. And I think, wow, what if I were to just make an appointment to be able to ask my vet any questions? And I think you do that with us for free for our entire community. And I am so grateful to you. I'm so excited for you guys to start dropping your questions. But importantly, let's talk about our wines for a moment, shall we?
Yes. What kind of wine do you have this evening?
What you got, girl?
I don't have the bottle, but this is a Bonterra organic Cabernet.
We almost opened that bottle.
We almost opened Bonterra as well. But this is the one that we bought a long time ago for Wine with Woodley Wednesday. And it was recommended at Total Wine. It's called Harvester, and it's a Cabernet Sauvignon.
I think it's Cabernet Sauvignon.
Paso Robles.
Robles.
There you go.
Yes. Could you tell us how to pronounce this wine?
I don't know if I can do that, but
it wouldn't be fun if we knew how to pronounce
Cabernet Sauvignon.
Sauvignon.
From Paso Robles?
Paso Robles, I think is how it's pronounced. So that is a region in California that is well known for its wine. So
yay.
There you are.
Also, I have a question for you. Did you get a haircut?
I did, actually. So Erin, who was with me earlier in our community's Q&A, she's probably like, what happened? But yes, I chopped it and I darkened it. So yeah.
It's hot.
Wait, what is that? Because like you just did that?
This afternoon, correct.
Oh.
Yeah, like, no, I don't know how to do this stuff. Like this doesn't happen in my house. So this is it. Like this is what it's gonna look like. So from the hairdresser.
I love it. I think it's amazing.
I just straighten it. When I do my hair, I just straighten it. That's all I can do. So that way I can focus on helping your cats. So
I love you.
There you go.
Erin said yes. I noticed.
She's like, your hair is a bit darker and shorter from earlier.
I have to say, there's a rumor I might get as many
you might get your hair
in
straightened.
Our community know. Yeah, I'm gonna
darken
right here. No, I've been cutting my hair for 2.5 years, ever since the pandemic hit. Been cutting my hair myself with, I know it's obvious, with pet clippers.
Oh,
right?
I do the same with Ryan. I literally I clip his hair. So
yep.
But we were talking about like, what if we've got Super Zoo coming up? Maybe I don't want to look like a chinchilla or a chinchilla. I don't know. Like, what if I went and got a professional haircut at Great Clips?
Oh, Great Clips.
Yeah, it's around the corner. It only takes 15 minutes. I don't know
15 minutes and $18.
I don't know if I told you, but I set an appointment with my actual hairdresser.
You did tell me.
I did tell you.
On a Saturday.
Yeah,
when I'm supposed to be shipping
the Saturday
orders.
before Super Zoo.
Anyway,
Yeah.
Excellent. Good luck with that.
Let's get some questions going, shall we? We've got Angela in the house with
Bernie's issue worse. I don't think it's a simple bacterial skin infection. It's like his skin is secreting sappy substance.
Oh, Angela.
Sounds like Candida. The skin doesn't stink. Oh, okay. It just smells like cat. But the hair my friend removed did smell. Not a stinking smell, just an unpleasant smell.
Sickening. I don't even have my glasses on. Sickening. Just an unpleasant smell. Dr. Kate, say you.
So first off, if there's something that's changed like this sounds pretty like significant in terms of what's going on with your kitty, Angela. I would definitely recommend a vet visit and getting doing a cytology where they can take a smear of what's going on. So that like sappy substance that you're talking about, they can take a swab, they can put it on a slide, they can look under the microscope and they can see, is there a yeast overgrowth? Is there a bacterial overgrowth? And you can get a better idea of what's going on. Secondly, so this is secondary to something. So this doesn't just happen. So we have to look at what changed. Are there things that changed in the cat's diet and the environment and the stress? What is the reason that potentially caused the skin change or the sappy substance to appear? So I'm always looking for like the root cause of what caused the thing that we're seeing now. So, right, we're seeing a symptom. That doesn't mean that's the issue. So yes, sometimes we do need to use conventional medications to help heal. But if we don't address the root cause, then of course that symptom can come back. So that's important. But it's important also to get, a diagnosis of what's going on externally so that we can treat that and the kitty can feel better and we can help them. So I definitely recommend a vet visit to see what's going on.
I agree. Go ahead.
What was the name of the test that you said to have your vet?
So it's cytology. So most veterinarians can do this in the clinic where we take like a swab sample. So this can be done with like ear infections. This can be done with skin infections where we take just like a cotton swab and we swab the skin, especially if there's something like it's like a moist lesion, a wet lesion, the sappy substance that you're describing, where we can just like kind of go like that across the skin or in an ear. And then we take a microscope slide and we put it on the slide and then we can stain it and we can look under the microscope. And yeast and bacteria look very different under the microscope and can help us indicate like what's going on. So we can actually use either antibiotics or, this is where you can decline the drugs and have a better idea and use natural remedies or, for depending on how the pet is feeling, quality of life is always the most important thing. So if your pet's not feeling well, they're not doing well, your cat's not eating, of course, using conventional medications and then supporting gut health, supporting the immune system with natural remedies is always important too.
I will say so. Prior to us going into business, we worked for 10 years in more dog nutrition. 95% of what we dealt with at our other business was.
I saw you sneaking water.
Was actually.
I'm getting ready for the stars, people.
So Dr. Woodley will start drinking. So what we 95% of what we dealt with was actually Candida yeast in dogs, and it was something that everybody that came to us was they've been to the vet, they have been on antibiotics and steroids, it goes away, but then it comes back, and now it's coming back worse, and over the past 2 years, I've seen more and more cases with cats, although it's nothing like. Cats are nothing like dogs in this realm. But I will say that I have seen that if this does turn out to be a systemic yeast infection, an overgrowth of yeast in the body, then treating it medically, from my personal experience, has been unsuccessful. It's successful short term, but long term, it takes it a few steps back, because we have to build that gut, we have to build that immune system in order to get the bad yeast out of the body, right? So we process the good and bad yeast, but we have to get that bad yeast out of the body. And with dogs, oftentimes it got worse before it got better. Once we switched that diet and started adding in supplementation, you started to see more symptoms that you have to try to keep at bay with, natural remedies, shampoos, things like that, in order to help. You're going ahead of me, okay? You're like,
I say that we're getting behind on the comments. Hold on. Linda said, what are the base vaccines for a kitten? He's from a shelter and already had a few rounds. Don't want to do anything unnecessary that won't serve him. Great question, Linda.
We did an amazing round table on cat vaccines. When was that? A week ago, I think. A week and a half ago. Yeah, last Monday. So definitely check out that video. It's on your
it's on our page.
Yeah, it's on your page. Okay. Yep. So Linda, definitely check that out, because we went in depth into the V word. The biggest thing is depending on what the exposures are, each cat is an individual. So looking at what does the cat need? Are they indoor, outdoor? What are their exposure risks? And also, what age are they? And so if they've already had a few rounds, I would say if they're going to be an indoor only cat, I would not be doing another round of the injections. And so this is something where you can also do titers, where you can look at you can do a blood test to see, do they have antibodies that are going to protect them against calicivirus, European leukemia, and make sure that they're going to be protected. We don't necessarily need to keep doing those injections and overstimulating their immune system, which can lead to vaccinosis and other health issues. So for a kitten that's already had a few rounds, especially indoor only cats that are at lower risk, I would hesitate to do further injections for them.
Injections, not the B word, and not the
that is. Yeah, I did. I'm trying to be good about that word, because
it was so hard on Monday.
It is hard.
Hard. Hey, Linda, bless you for rescuing a shelter baby too. Yes. By the way, bless you. Madison said I had to start giving Tommaso
mirtazapine. It's an appetite stimulant. So it's a common appetite stimulant. So many internal medicine doctors, even holistic veterinarians, can prescribe this to help them eat when cats aren't eating or dogs aren't eating. And I know Tommaso has a heart issue that was just recently diagnosed and is having some health issues. And so in terms of if he's seeming nauseated, or we're worried about nausea causing his inappetence, so he doesn't want to eat, mirtazapine can help stimulate the appetite, but we also have to address nausea. So this would be looking at a medication that we commonly use would be Cerenia. So Cerenia and mirtazapine tend to be safe for cats. Now, each cat's an individual, and each cat has different genetics and the way they metabolize drugs. So I can't always say they're not going to have a side effect. Now, if Tommaso's had Cerenia in the past and he's done okay with it, I'd be asking for either a Cerenia injection, or I'd be asking the veterinarian for a prescription for oral medication. And the injection can be given by technicians, and it can also make it easier for pet parents if you're like, I don't want to medicate my cat at home. I know how that feels with cats that have been through cancer. I'm like, you do all the bad things. I don't want to be the bad person, right? I don't want to create more stress at home. So we need to make sure we're addressing nausea, but mirtazapine can come in a topical where we can put it on the inner ear. So it's absorbed into the skin, and then it's absorbed into the system, and that's how it works. Or it can be given as a little tablet. And they tend to be pretty small tablets. So, if we're finding Tommaso, I know a little bit more about this history. So if we're finding that he's not eating a lot, which I know he's not, I'd be using potentially those 2 medications to help him eat enough. So we're not worried about him getting fatty liver disease and having health issues from not eating enough, and going there. But we need to address nausea. We need to address the appetite. This is also where I'd be putting down an herb garden from our beautiful friend Julianne from Naturally Cats. And I'd be looking at, we need to address stress. So this would be something where I'd be looking at your valerian. I'd be looking at, there's lots of changes. Your rosebuds are great for changes. I'd be looking at hops for calming anxiety. I'd also be putting down for them to self-select things like peppermint. Do we have nausea? Peppermint's really good for helping with that. We can put down spearmint if you have that. We can put down St. John's wort to see if your cat self-selects it. So there's a lot of great ways that we can use to provide options for our cats to help them when they're going through a health issue like Madison's kitty is going through.
Let me ask you another quick follow-up question about that, because it's peppermint, spearmint,
that was my question.
Peppermint, spearmint, and St. John's wort, if you look it up on Google, says all of them are toxic to cats.
Yes. So what we're doing is we're allowing the cat to self-select. So this is where we're giving your cats the choice to choose what their body needs. And this is where I use a lot of essential oils too. Like I diffuse a lot of essential oils in my house. I have not killed one of my cats in the past 8 years doing that. What? What'd you say?
You said it like I haven't killed a cat in 8 years.
Cats, they're still, I mean, here's the thing. I've never seen a toxicity in my cats. If you're going to see a toxicity in your cats from essential oils, it's going to be very quickly. It's going to be within 24 hours of introducing an essential oil or something to them. That's the thing. It's not going to develop 30 days down the road. So I want to clear that up. The other thing I do is that I allow my cat to come and go. So you can see behind me right there, that is a ripple rug. It can also be used as an herb garden where I can put down dried organic herbs for my
cats. Right here too.
Our ripple rug is down right now.
Yeah, exactly. So the door to you can't see the door. The door is right there. And a lot of times you'll see a cat sitting here. For some reason, they're choosing not to be with me. I'm not diffusing anything. I don't have anything down, but the cats are just not with me today. That's fine. Cat tends to sit here or here or here. And they can choose what their body needs on that day at that time. And that's the power of self-selection. And so we can put down dried organic herbs. So if we're using peppermint, my cats have never self-selected peppermint. Sometimes I will use it. If I see my cat vomit, I'm like, let's put down peppermint and see if they actually need that. So that way I'm providing their body with what they need. We're not forcing it into them. I'm not taking that dried organic peppermint and forcing it into their mouth or mixing it into their food. So this is where we're allowing them the ability to choose. That is the power of self-selection. That is the difference in forcing something into them that maybe they don't need or they don't want. So that's a very important distinction between giving a drug and doing that type of thing.
Sorry, I'm trying to.
Paul's done.
Sorry, right there.
Ban user.
Block. Bye.
Okay. Sherry has a question. My black kitty came to me with no tear ducts, so his eyes run a lot. It doesn't seem to bother him and he can see okay, but I still worry about him. Is there any chance his eyesight could be affected down the road?
Interesting. So the tear ducts, so if tear ducts are blocked, having no tear ducts is not common, but it could potentially happen, like with Sherry's case. What can happen then is we see the tears drain down here. And so the biggest thing that I would say is making sure we're not developing things like dry eye. This is where your veterinarian can do little test strips where they can tuck them under the lower eyelid. And we typically test it for 60 seconds to see how far it progresses along this tear strip. So if they're producing enough tears, that tells us they don't have dry eye. The other thing, typically if they're blinking, they're going to be distributing the tears and it's going to be lubricating the eyes. So I wouldn't be too worried about that. But the tear ducts essentially are going to allow the tears to drain through, so they're not getting over the skin. Biggest things I'd be worried about are skin infections along where the tears are draining, because what's happening is that skin is always going to be moist. So you can always use unscented baby wipes or just a cloth to wipe away those tears. The goal would be to keep that skin nice and dry so they're less likely to develop an infection. So that's what I would be doing, Sherry, is just keeping that skin as dry as possible and just monitoring the eyes for increased redness, swelling, dry eye at their annual wellness visit. And I wouldn't expect their eyesight to be affected from the tears. So very unlikely that they would go blind or have eye issues in that regards.
Simply because of the tear ducts. Yeah. But I would label this kitty a special needs kitty, as in you gotta keep up with that. If the eyes are running all the time, you just have to keep up with that. That's beautiful though. Thank you for loving that baby. Okay, here's Tina says,
my 3-month-old Siamese kitten still wants to nurse on my shirt often. Should I allow it or try to wean him?
I honestly, like,
that's an opinion, right?
I don't think it's a bad thing. A lot of kittens that were weaned too early from their mothers will display this behavior. And yeah, exactly. And it's not a problem behavior. I think it's cute, to be honest, like where they're suckling on things. So I don't do anything to discourage it, because unless they're ingesting, yarn or anything like that, then yes. But honestly, like, we used to have a cat when I was growing up in my teenage years that would come and like knead and then like suckle on me. And I was just like, I love you, Maggie. And it didn't affect her. It was just one of her self-soothing things that she did because she was weaned too early, most likely. I didn't know her previous history. She came to us with her little 3 kittens, but Tina, I wouldn't be worried. Just, it's a cute little thing.
It is. It's a self-soothing.
I have to say, Madison and Jack both came to us. They were probably anywhere between 6 and 8 weeks old. They were definitely weaned too early. They lost their mama somewhere before our pet sitter, Sarah, found them. And both of them were super sucklers. I mean, anything like their bedding, they're crazy. Jack has maintained that habit when he's like super happy and lovey.
Are you gonna tell the story?
He loves to suckle. I wish, he's such a ham, right? I love him so much. I'm like, dude, why can't you just be a little more normal? Because his thing is he loves to suckle the waistband of anything that I'm wearing. At night, during the day. I mean, just depending on. But he, for whatever reason, he does the biscuits. He's so happy. He just gets so excited. So no, I don't think you should try to wean him. I think that's.
I think the only advice I would offer is make sure that you're using a natural detergent for your clothes.
Yes.
So that whatever is suckling is not going to be potentially harmful.
Yes. Okay. Next up, Tony.
More creepers.
I know the creepers tonight.
What diet would be better for a hyperthyroid cat? Frozen raw, freeze-dried raw, or lightly cooked? Are there certain health conditions where raw might not be a good choice? Hyperthyroidism, I would say, is not one of them. But what say you?
Yeah, no, I agree. Like, hyperthyroidism isn't. Sometimes you have to be careful with like iodine levels. This will depend on the cat, and there's mixed opinions about that also. So it's one of those things, like, what is your cat feeling the best with? What does their blood work look like based on what you're feeding them too? So that gives you an idea of how well they're doing based on how well they're regulated. And in terms of like raw, I always say raw is not for every animal. Sometimes they don't do well with raw, and we sometimes need to do a lightly cooked food. This is going to be more for your pets that have severe GI issues, that are going to be for your older kitties potentially. And that doesn't mean that every old cat has to be on a raw food or on a lightly cooked diet. There are a lot of cats that are older, that are seniors, that do really well with a raw food diet. So if your cat's on a raw food diet, they're eating it, their stool is good, they're not vomiting, they're not having GI distress, do not change them based on that. This is where we have to look at the cat as an individual and assess, like, how are they feeling? What does their stool look like? Do they have GI upset? Cats should not vomit frequently. Every now and then is okay. But like cats that are vomiting weekly, every 2 weeks, that's not normal. We shouldn't see that. So that's where I'd be saying, okay, we need a more lightly processed food, and that can be lightly cooked. And we have to look at the energetics of the food. Raw tends to be cooling. And that's why a lot of these older pets or cats that have GI issues don't do well with raw diets. It's cooling. They need a lightly cooked, warmer, energetic proteins. So sometimes using chicken is not a bad thing. A lot of people like chicken has a bad name, and it has a bad name because we use really poor quality, altered chicken and kibble. It is not chicken anymore when we have kibble diets. And so keep that in mind. There's a lot of cats that do really well with chicken because it's slightly warming and they can digest it really well. So don't write off chicken just because of everyone saying like chicken is bad. Every pet is allergic to chicken. That's not true. But I'd be looking at how is your pet doing and assessing that. And if they're doing great with a raw food diet, I would keep them on that.
I love it. I know that feline leukemia is one of those conditions that you might want to be careful
or
with.
FIV.
Or FIV.
You might want to go to
an depends. It depends though. Like I don't necessarily put them off of a raw food diet because here's the thing. Raw food companies, they have stricter requirements than your kibble diets. That's the thing. We have more salmonella recalls from kibble diets than a raw food company.
Way more.
Way more. That's exactly right. And the FDA is like honing in on raw food diets. If there's a little bit of a foodborne pathogen or anything, which is crazy. Like if you think about, you go to the store and you buy chicken off the shelf, the fact, like if you did not wash your hands, if you didn't use like clean processes, like cooking your food, you have a really high risk of getting salmonella poisoning. That's a fact. But for pet food, raw food companies, they are like zero you can't have anything. And if they do, they get recalled. So I feel like that can help pet parents because there's a lot of fear around that. And it's probably safer to eat the cat and dog raw food than it is to eat like the raw chicken off our like grocery shelves. I hate saying that, and I don't recommend that. Don't do that. But honestly,
and according to the recalls, it's a lot safer to eat a balanced raw food by a raw food manufacturer than it is a kibble.
Exactly.
Yeah,
exactly. Exactly. Yeah. And yeah, so it's one of those things where I always look at, what do our cats need? They need a high protein diet. Why would we feed them a processed food diet when we shouldn't be feeding that to ourselves, right? I always go back to the analogy of like, if you were to take your child into your pediatrician and you brought like Cheerios, right? And you're like, should I feed this for the rest of my kid's life? They'd be like, what the heck are you doing? And it's the same. If we were to take like a kibble bag to to the doctor, we should be saying, what are you doing? Like, it's the same exact thing as feeding Cheerios for the rest of your pet's life. It's been fortified by vitamins and minerals, but they're synthetic vitamins and minerals. We can do so much better with real food, organs, meats, bones, the things they would naturally get in their environment. But we've moved so far away because the vet community has unfortunately been swayed by, the big companies, and it's a tough place to be in. But we got to go back to like, why would we feed processed food diets for the life of our pets? It doesn't make sense. The same food every single meal does not make sense.
Right. Go ahead.
Well, it's beautiful common sense, and I do want to say one of the brands that I really like that I've eaten and I think is quite delicious is Smalls, because they really have found that sweet spot between the overly processed foods and a fully raw diet, which I know is nerve-wracking to a lot of people because either they're scared of it or maybe, as you said, it's not a right fit. Maybe they've tried it and it's not the best
just
fit.
Don't like it.
But Smalls is one of those great brands. I'm not sure if we still have their link in our description, but check them out too if that's something that you guys are considering.
Open Farm is another one that's really good too, that has a lot of different options. So they're a great option too if you're worried about doing just a raw food diet.
I have a go ahead. No, I mean, I just don't forget. Okay, I'm just going to say it right now. Don't forget to remind me to say something because I'll forget later. But so we feed our oldest, who's 18 years old, and I believe starting in the stages, we have a vet appointment to set for him. Another one for his thyroid. I believe early stages hyperthyroidism. I just believe that his last results were fine, but he has been acting a little bit off here and there now and again. And we give him processed food. So we give him some wet food in the afternoon as their, snackaroo, their little treats. And he loves it. And the other day, Adrian put some down for him. And this, going back to self-selection, he looks at it and he looks up at her and he sniffs it for a half a second and walks away. This is a really good brand of wet food. And he loves it usually. And he sniffed it and walked away. And we're like, oh God, what's wrong with him? Oh, do we need like emergency vet? Like we're, a little bit stressed because he was really hungry and he just turned his nose up. And then Jack comes over, who also always wants to steal his food in the afternoon, and comes over and sniffs it and does this like backup thing. And I was like,
how dare you?
That's actually bad food. That food is expired, or there's something wrong with the food itself. Let's throw that away and get another can out. It's actually in pouches, but we're like, let's get another one out and try that. And they dug into it. So it was something that was actually wrong with the food, going back to self-selection, going back to peppermint, going back to if it's going to harm your cat. So many, like our cats are so smart and they detect that with their little smeller.
That's so true.
Yeah.
You're getting wavy.
Exactly. And the thing is too, here's the other piece with that and the self-selection. Sometimes your cat wants more warming proteins. Sometimes your cat wants cooler proteins. So if they're not choosing something, look at what you're feeding and be like, okay, so maybe we're giving turkey and that's a cooler protein and they're not taking it. Let me see if I have, then this is why, like, I have all sorts of different types of proteins, different types of food in my house, because I'm like, I got 3 cats. I mean, I'm like minimal compared to you beautiful ladies, but it's like, I want to make sure I have a variety because I know that they're not all going to be the same. They're not all going to be the same each day, and their preferences change. Like we think about ourselves. Do you want to eat the same thing every single day? No, I don't. Like, why would we? We need variety. And so this is where if like my one of my cats, or, I offer like say lamb and that's a warming protein. And they're like, no, I don't want that. Or Moki vomits on lamb. And I'm like, okay, he can't do warming proteins. And also too, I also know he has leaky gut because we've tested him. So I'm like, okay, let's use a cooling protein. Let's add in things like slippery elm and other supplements to help support his digestion. So now we can look at the different types of foods we're offering and we can adjust them. So what it does is it empowers you as the amazing cat parent that everyone here is to be able to look at their cats and be like, okay, today they don't want a warming protein. Maybe let's go neutral. Let's go cooling. And you can choose different things to provide to them and see what they take. And it gives you more information about what's going on internally, even if they don't have like outward symptoms and things like that. And that's how you can help balance them over the long term. That's part of that whole self-selection principles that we were talking about too.
I love that. Oh my God. Thank you, Rob, for 100 stars. Cheers, ladies.
Oh, wow. Thank you, Rob. I see Rob's question coming up here and I can't wait to read it. But we've got the beautiful Pam Roussel in the house.
I have to throw out there real quick, talking about the variety of proteins that our cats, this is their first time, but they absolutely love it. This week, one of their proteins is frog leg.
And they're big fans.
And they love it.
That's great. Yeah. I mean, it's funny because I get a lot of, I can get a dog in anytime, but can you hear me?
Oh, you're frozen. Okay. I think you're back. You're back.
Okay, good. I can still hear myself. I just saw this so we used to have a dog, and now, of course, once Finn's gone, we get all these like samples of like, great treats and supplements and things for dogs. And there's great like freeze dried, rabbit legs and things like that. And offering them to our cats, it's fascinating watching what they do, freeze dried spleen and things like that. And it's fascinating, like just watching what they do. And our cats tend to forget if they're not outside, like who they are, where they came from. But it's neat because you can sometimes use that to see like, okay, let's add in, maybe let's try some like rabbit leg if you're up for it. I mean, it takes a special person. I'm not going to lie. I put it down. And I was like, okay, this is special, but it helps their teeth. And if they want it, they also, too, it's something new and novel, and it's engaging, and it's environmental enrichment. And like, even if they don't take it, they don't chew on it, and they don't, do whatever they're supposed to do with it, it's still environmental enrichment and helping them. So that's been interesting, adding that into our cats' lives, and seeing what they do with some of these different things.
Yeah, Friday was absolutely in love with the rabbit ears. She was like,
yeah, it's special, right?
No, and I was like, what do you think, baby? And she didn't consume it, but she licked it and she played with it and she kicked it and she was like, yes, this is mine. Yeah.
Anyway,
Pam Rousseau is perfectly holistic.
Pam was part of our beautiful roundtable that we did last Monday, so a week and a half ago, about the V word. And here now she has a client that wants to know if you think the feline leukemia vaccine is needed if someone wants to adopt a feline leukemia positive cat.
Okay, so how long has it been? Tico came to us last year around Thanksgiving time, and he was an outdoor cat that wandered into my parents' house. They couldn't find his owner, and we ended up with this blessed soul. And so one of the things we needed to do to introduce him to our indoor only cats was we needed to test him for feline leukemia to make sure he didn't have it, because this is a highly contagious disease. So you want to make sure that if you're bringing a cat in, that they don't have this, because it can be transferred through saliva. If they have feline leukemia, they do not need the vaccine. This is why it's so important to test to make sure that they don't have it. And this is also why if you're bringing a new cat in, you need to isolate them until you can test them to make sure that they aren't feline leukemia positive.
Well, and I just want to reiterate that I think that every veterinarian understands that a feline leukemia positive cat should not be revaccinated. Let's flip the question a little bit and say, what if they're asking about if they're adopting a feline leukemia positive cat, should the other cats, if we're looking at multiple cat households, did they get the vaccine?
And what is the efficacy rate?
So this is where, this is hard.
Yeah.
So this is one of the things where your other cats, I mean, I don't want to say you shouldn't adopt a feline leukemia positive cat, because I don't want to say that. Nope. But it is a risk for the other cats. So I do have to say that. So you do have to think long and hard. This is where people who don't have other cats, it's great to bring in a feline leukemia positive cat. So yeah, like.
Well, let me just say, so we were asked to speak at Feline Leukemia Day a few weeks back, and one of the things that we said that I think a lot of people were shocked with was talking about the vaccines. Ooh, the V word, the jab,
there we go.
Is that
it's over.
A cat with feline leukemia has a weakened immune system.
Yes, and that's why we're seeing it.
The overwhelming majority, I want to say, of veterinarians know that you should not give a sick cat any.
Well, they know it, but do they practice it? That's
right. So, but we as cat parents should be empowered to say these things and ask these things to our pets. It's on the bottle, it's on the packaging of the vaccines that it should be given to healthy animals. So that's one thing. I will say too. I lost my soul cat to feline leukemia in 2007. It just went down fast. We had no idea what was going on. He lived with Oliver Twist, who is still with us today at age 18. And four of our other cats Okay, 3 of our other cats. And none of them have ever tested positive, and they all drank from the same bowl. We were feeding people at the time. They all ate from the same bowl. They all drank from the same bowl. It is a contagious disease, but immunity health is really the key over any kind of jab or injection.
Yeah. So that's like human health too.
Right.
Biggest thing in this time and day, because I'm seeing it with my clients and my patients, there is a ton of stress. So if you have a ton of stress in your house and you feel really stressed, your cat is picking up on it. Mm-hmm. And so this is really, really important. So if you're thinking of bringing a feline leukemia positive cat into your house, make sure your other cats are in a good place. Make sure you're like meditating, you're taking care of yourself, because that is so, so, so important. Make sure you're doing testing, hair tissue mineral analysis tests, animal biome testing, looking at the microbiome. Like this is things where I see so, and I hear this. I have a husband who has an autoimmune disease. He is the reason why I found holistic medicine, because he was fine one day and then he wasn't fine the next day. And he was diagnosed with an autoimmune disease, changed our lives. And just because your cat doesn't show symptoms doesn't mean that there's not something occurring inside of them, like inflammation, oxidative stress, microbiome that's off. This is really, really important. And this is why preventative testing is so key, because we don't know, like if we don't know what's going on, we can't fix it. So doing that testing, what you can, is so, so, so important. And also too, if you're like, I can't afford that testing, that stuff is really expensive, make sure your cat is on a species appropriate diet. That microbiome is essential to immune health. We know 80% of the immune system is in the gut. And so this is where, especially right now, because I'm seeing so much emotional health issues that are affecting pets, and it may not be showing outwardly right now, but it's just key. And so using this feline leukemia thing is so important, because immune health, gut health, we need to make sure our cats are strong. We need to also be addressing ourselves. We forget that. We are so important for our cats living a long and healthy life. And I will be the first to admit, I go down the path of like saying, I'm fine. It'll be fine. It'll be okay. I'm fine. Right. And we just like shove the stress aside and we don't address it. We don't deal with it, and we just move on. We've got to stop doing that as a society. And so for everyone here, like, I know this is about cats and I'm going on a soapbox right now.
I love it.
Please take care of yourselves, because your cats are picking up on it. And they're going, mom's not good, dad's not good, let me help them. And they absorb your stress, they absorb your emotions, and they may not show outward signs. Once again, just because they're not showing outward signs doesn't mean that things aren't occurring internally. So that's my soapbox. So
I love your soapbox, because I do think, and I know that the pandemic had a lot to do with a lot of it, but I do think that our human health, our mental health, emotional, spiritual, whatever health, I think that we have seen just such an influx of issues that are so idiopathic, unknown, but they are really behavioral health issues.
Still going back to, if you're going back to the
looking
root,
at the root, we have to do that as well. All right, so let's switch it up. Here is Rob Milligan, my favorite wordsmith, and he said, as I continue with this as I commune with this fine roll of Nicaraguan tobacco, I'm of a mind to ask about the obvious absence of pork from the wild variety of meats offered by the freeloaders, preferred wet foods. The freeloaders are his babies.
So now,
I figured, yep.
Right.
They are, I think,
bacon hounds who would run a busload of nuns off the road to get to my Saturday morning bacon. Should I not give them any? Thank you, Rob.
So, Rob, you can use pork as a meat source. In terms of feeding them bacon, I would, bless you, Ryan, if you are listening to this podcast. I don't know if you're listening live. However, Moki, our little cerebellar hypoplasia cat, doesn't care about me when we sit at our dining room table. He sits on the ground and stares blessedly at my husband with shut eyes, just like, Like, I love you so much because my husband, I love him dearly, gives him pieces of like meat and things. Like he literally knows when he's going to get like little table scraps. So table scraps are not a bad thing when you're giving them species appropriate stuff. And a little bit of bacon is okay. So I'm giving you that. A little bit of bacon's okay. Now, bacon, what type of bacon are you using? So in our household, we're using nitrate free. We're trying to use, the cleanest bacon that you can use if you're going to eat bacon. Bacon can be one of the dirtiest meats. And it can be full of preservatives. So if you're using the cleanest bacon that you can get, then Rob, I am fine with little pieces as a little treat. So that's okay to do. So I think that's fine. And if it's like once a week, it's not every day, that's okay. It's okay to have a little bit every now and then, just like it is for us. So I'm okay with that. And it might be different. I might get slaughtered by that, but I think it's okay.
Even as a food topper, and I will say, Jake Perry, the one man that owned the 2 longest living cats in the world that lived to be 34 and 38 years old.
Wine to the cats.
They did feed wine. But he fed bacon and eggs.
And wine.
He gave his cats bacon and eggs.
Yeah.
I mean, they also had a fully balanced processed diet.
Yeah.
But
you're not going to feed just bacon. Like that. If you're doing that, not good. No. But here's the thing. It's like for yourself, if you're eating a clean diet, are you never going to have like chocolate? Are you never going to have another ice cream ever again? Like a little bit every now and then is okay. So, I think giving your cats a little bit, like it's engaging and they love it and it's okay to do.
It's fine. It's fine.
Little treats. Thank you, Rob. Dana
in the house said, I suspect Jasper may have some small issues with his eyesight. Any way I can troubleshoot that to figure it out one way or the other, Dr. Woodley?
Wow.
So as I always say, make sure you're checking in with your veterinarian because there's different ways to test like the eyesight. And there's different ways to look at the lens, to look at the cornea, to look at the retina. So we can see if there's retinal degeneration, if there's cataracts forming. So definitely make sure that your veterinarian is taking a good look at the eyes. If you're worried that your vet's like missing something, if you have an ophthalmologist nearby, see if you can get an exam in with them to see what's going on. When we know what's going on, it's a lot easier to treat rather than guessing, because I find when we're guessing, we tend to spend a lot of money on supplements, and you don't always have to. Like supplements should be meant to supplement. They're not meant to just like give everything that we feel like is good. So I definitely, Dana, recommend that. Things that can be really helpful for eyesight are going to be your omega-3s. So this is going to be your fish oils, your algae oil that are going to help naturally reduce inflammation. Lutein is really good to help also. So I believe Dr. Mercola has a great eye supplement. I can't remember the name of it, but if you look at
eye support.
Okay. Yeah. They keep it pretty easy. Like everything like liver support, kidney support, eye support. So you can do eye support. So, looking at something like that would be really helpful, but you're looking at your antioxidants, things that are going to naturally reduce inflammation. People who are into raw feeding and feeding organs or things like that. I mean, there are people that are feeding, this will be really gruesome, but like eyeballs. I mean, eyes feed eyes, just like liver feeds liver. Adrian, I know it's gross, right? But
hello, bye.
But it gives them the supplements that they need. You're feeding the organ system that will help them. So,
do you know if Standard Process has like an eye? Because I know they make all the like organ. Do they have an eye support?
So for cats, what I'd be looking at if we're worried about an eye issue, I'd be looking at feline whole body support would be the like number one. And then I'd be looking at potentially like the feline immune support. So just because we're worried about like the immune system and potentially like they also have some omega-3s. In terms of other things for the eyes. The problem is we're stepping into human supplements, which can be harder to give to cats because the dosage is based on like 150-pound human. So for like my big dog patients, it's nice to like dabble into the human supplement side for standard process, but it can be harder to give to cats just because they're pickier, they need less of it. So feline whole body support is a great glandular whole food supplement support that I highly recommend, and you can give that to any cat. It's like a great natural supplement, like multivitamin and whole food form that you can use.
Yeah, I would also say, because Dana is one of our VIPs, so I would also say you could reach out to Pam with Perfectly Holistic or an animal communicator to ask about the eyes. If we're gonna be woo woo,
Danielle, another beautiful VIP in the UK. Oh, Donahue. This might be a silly question. Is it normal for cats to snore? Patty snores really loudly, but it sounds a bit wheezy. But
it's
only
when he's sleeping.
Asleep.
Is it a change? That would be my first question. Has this always been a consistent behavior? So anytime you're worried about something with your cats, you have to go. And this is why I love journals. I love clients like that journal. And like they're like, I'm so sorry I'm sending you like this entire journal. Like, I love it. I'm like, oh my God, I love you. So the journaling thing where you can identify, are different foods affecting behaviors? Are there different supplements? Is stress affecting things? Those are going to be all factors that can play a part. So my question for Danielle would be like, is Patty always snoring? Has there been a change? Does it relate to different types of foods? Does it relate to different supplements if we're supplementing? Does it relate to stress? Snoring necessarily, it potentially could be a normal thing, but I always wonder, is there some inflammation that's occurring that's causing the snoring? So that's how I would look at that, especially if there's a bit of wheeziness. I would be looking at like tracking that. So Danielle, if you're not already tracking it, start tracking it now and see if there's a pattern when the snoring increases, maybe when it worsens, and that can give you an idea of when things are potentially being affected or causing the snoring to be worse.
Have you ever heard of a cat having sleep apnea?
Well, how do we diagnose it? I can't, that's a problem. So I've had multiple patients where snoring, I had one, so it was a dog, and this dog had its tonsils removed. It had multiple health issues. It was it literally would like sleep under the owner. And during Zoom calls, like people would be like, what is that noise? Like this dog's snoring was so loud that, I mean, it was like, that's not normal. Like there's something going on. And I mean, sleep apnea is not normal. And so whenever I hear like the snoring loudly, my mind goes to inflammation somewhere in the throat, the nasal region, like anywhere airflow is occurring, and especially wheezing, and cats, asthma, like 100%. Like, I start thinking about those things. Doesn't mean that like, Patty has asthma, but those are the things that I'm thinking about, because snoring's not a normal behavior for any species.
I was going to say, do you think that stress can play into, I mean, this is just an opinion, but do you think that stress can play into snoring? I'm asking because Twist, our older boy, when he's sleeping, sometimes when he's sleeping up on the catwalk, we'll hear him from like wherever we are in the house. We'll hear him snoring, but he'll come to bed with us some nights, and like last night, and we just like give him a bunch of love, and he's just like, I feel so comfortable here, and he lays down and he sleeps all night with us, and no snoring whatsoever.
Do you change his types of proteins or supplements? Okay, so what I would do is I would start journaling about it, because what you might find is trends. And so what you can track, once again, food, types of protein, stress, supplements. And then that way, what I would do is I'd keep things consistent for 3 days at a time. Typically 3 days is going to give you enough time frame to like see if something's being affected. And if you have like a delayed onset, like say like food sensitivities, usually within 3 days, we're going to see something flare up. And so 3 days is a good time frame to keep your supplements, keep your food the same, and journal about what he's doing and if he's snoring. And that's going to give you a better idea of like, maybe he has a food sensitivity, but stress can create leaky gut, can create inflammation. So this is also where like stress levels, like how are Jay and Adrian doing today? Like
That's
checking in. Yeah, like a check-in, right? Like Jay and Adrian are doing great. Jay and Adrian are not doing great. Like today was really stressful. And, you know, this is also a good time to, like what I was saying before, we're so good at saying like, we're fine. And we just like continue on, especially, you know, for all of us who own our own businesses, you just like truck on and on and on. Like you just get through it, right? Like things can be really stressful and you're like, we just got to do it. We just got to get on, and we don't check in with ourselves. So having that checklist at the end of the day to be like, how did we do today? How were the cats? What were they doing? How were they interacting? Like, I mean, we've got multi-cat households. Like, you know, for myself personally, I'm like, did Tico react to other cats? Like, did he interact with Kiwi? Did he attack her? How did Kiwi do, you know? And this is where in your situation too, how did Twist do with like other cats? How did Jack do? You know, if you have reactive issues, like this is where it'll give you an insider view into where potentially inflammation can occur in the body because of outside factors. So that's the power of being able to journal about those different things and give you an idea like, oh, shoot, we need to actually like address the emotional side more.
Right.
We need to make sure we're playing with him more. Like, you know, we were really stressed. We didn't take them in. I know you are amazing at like taking them into a separate room and playing with them individually, you know, but like, that's the thing.
I mean, like, I mean, remember probably way more than we ever did before.
Yeah, you're a lot better than me. I will give you that. Like, I'm horrible at that.
Yeah,
like,
for example, we don't talking about checking with ourselves. Today was a super stressful day, and it was like our cats were dying of boredom, and they just kept letting us know because we didn't have time to engage, and that's so important for us to just evaluate on a regular basis. And speaking of checking in on ourselves, I do have to say it's a 701.
Oh, shoot. Wow. That went fast.
Oh, yeah. It just dropped 155 stars. Sylvia.
You guys, not only do we have the beautiful Dr. Katie Woodley with us here tonight, we also have the VP of Life. Our Trish Whittier is in the back. Hey,
like, hey.
If you need to go, you can go if you need to. And Dr. Katie, I need to ask what your personal time clock. Really? Go a little bit longer?
Let's go a little bit longer.
Trish, how you doing? Oh my God, she's had a hard day too. Wow, I love you.
It's been a long one.
Okay, Shelby said, wondering if Dr. Woodley has any insight on switching to
Shelby, we got something in store for you. We released today. So we actually released. Yes, Trisha will drop this in the comments.
Yes.
So we actually released a simple guide to your optimizing your pet's nutrition today, which covers dogs and cats and covers how to transition them, covers different brands of food from all, like even kibble, which I don't recommend for your cats.
I saw that.
So don't go there. Like that's the easy option. Don't go there for your cats.
Transparency. Hats off.
Yeah. So go to, pre-made, lightly cooked, raw, freeze-dried options that are in there. But there's also how to balance homemade diets, and also too, like why it's so important, and also what to look for on ingredients to make sure that it's not going to create inflammation in your cat's body. So Shelby, download that. It's all free. And I'm giving it away to you. So definitely check that out.
I have to say, I downloaded it this morning, and I am just floored at the amount of information.
It was like a text thread that went out, and Adrian's like, "Look at what
hey, but to address Shelby's question, she commented again, and she said, "I have 5 different breeds of cat. How do I determine if each of them are getting a balanced diet, or raw?
Right.
Does breed matter when it comes to cats?"
That's a great question.
So no, it doesn't. Honestly, so cats are obligate carnivores. And so they need a high protein diet, like least processed. Processed food is kibble diets, and they're going to have a hard time absorbing vitamins and minerals. So if your cats, like whether or not they're different breeds, are doing well. So this is where we can look at, okay, we're feeding. So maybe you're feeding a raw food diet and all your cats are eating a raw food diet. Are they feeling good? What's their energy levels like? What's their stool look like? Are they having any vomiting issues? Are they having any other symptoms like itchiness or, aggravation? Are they irritated? What are their behaviors? So going through that checklist and looking at them as an individual, I don't look at breed. I look at individualness. And so and I'm pretty sure I just made up that word, but
I like
individualness.
Individualness.
But it's true. Like each pet is an individual. They all have different genetics. They all express things differently. They're going to absorb foods differently. They're going to have different toxins, stress levels, things like that. Like cats that are super chill versus cats that are kind of like hyperactive, reactive are going to absorb things differently. So making sure that you're looking at each of those cats and how they're doing is really, really important. But, Shelby, download the guide and looking at the different brands. That's really, really key in terms of feeding a balanced diet. So if we're using brands that are testing the products and making sure that the foods are balanced, that's the key thing. And then seeing how your pets do on them.
Yes.
I love that. And that guide is just fire. So thank you for making it
Trish
available.
has dropped it. We have dropped it right here in the link or
Thank
in
you,
the
Trish.
comments. So if you need to, where did Trish go? So you guys can click on that to get it. And
Sylvia, our star giver, thank you again, my dear. She said, because of supply chain issues due to COVID, my regular wet food that all three of my kitties like is unavailable. We've been on a major food tour to find a new high quality food that they like, but I think I've confused them, and now they don't seem to like anything. Advice on how I can remedy this problem that I've created. That's a great question,
when
Sylvia.
you're feeding the same food over and over and over that your cat likes, and then all of a sudden you try to switch it up, maybe because of a supply chain issue, or maybe because you bless you or maybe because you're trying to add variety to the diet and the cats are refusing it. What do you say?
So this is where I use toppers to help them. So this is where using like freeze-dried chicken, using your liver, your freeze-dried like liver, heart, things like that to sprinkle on top. Oh my gosh. So Tico, our kitty, has trained us that he will eat his raw once I sprinkle the Majesty's freeze-dried chicken on top. Yeah, we've all been trained by our cats.
Oh, they've got beef, bison,
and they all want something different.
Yeah. So that's the thing. You find like what they like, and I go, okay, like it's a little tiny, like honestly, it's like that size. And once I sprinkle it on his food, he eats it. He'll eat a little bit, and then I sprinkle it on, and then he eats the rest. And I'm like, that's fine. That's not unbalancing his diet. Exactly. Yes. I'm like, here you go, sir. You're like, but exactly. So sometimes we have to use toppers for our cats. Our cats can be picky. And so Sylvia, I would definitely tap into that and look at using some of these toppers that are out there. You can use bone broth. Nutritional yeast can be a good option too. And that adds a lot of B vitamins into the food too. So looking at B vitamins, bone broth, freeze-dried chicken, your freeze-dried organ meats, all of those can be additional toppers that you can use onto your food to try to get them onto a diet, and then variety and rotation.
And I want to give a shout out to Green Juju.
Yeah.
Is that what you were thinking?
No, I was thinking something else, but Sylvia, hold on.
Okay. So shout out to Green Juju. Our cats are absolutely in love. It's super healthy, but our cats absolutely love different cats love all the different flavors. And that's a great, very easy to just like in your hand,
the beef's
and it turns into
hard.
powder.
Yeah,
the beefs are a little bit, I mean, I have strong hands, so it's not that hard for me, but
Adrian, you have soft hands.
Just
my baby.
just so
Hey,
good.
Sylvia, I do want to say this though. I think that this is a great opportunity for all of us to realize that during these crazy times, we are going to have supply chain issues, right?
Yes.
And it is really important for us to make sure that we've got different options for our babies. So when it comes to finding a good quality food, we all have to understand that we are our cat's only choice for better nutrition. So go find those brands that you know are good. If your cats have a texture preference, then try to find different textures in those good quality brands that they do like. And then power of toppers, man. I'm telling you, it is, yeah, they really do help. And it's awesome to be able to have a bunch of different brands. We say bunch of different brands, bunch of different proteins, so that if not only does that give them great variety and formulation, I mean, there's everyone, obviously we have AFCO guidelines, but there's always going to be a certain variation. So you're really giving them a great variety and also a great variety of proteins. Like Dr. Katie Woodley was saying earlier, as far as our cats self-selecting, maybe they don't like the food right now because it's a warming protein. Maybe they want a cooling protein. Let's give them those options, you know, the spice of life variety. So great reminder to all of us though, to have kind of a be stocked like Dr. Katie is. Bunch of different brands, bunch of different proteins, so that our cats have those options, especially if it's something that we're not prepared for, like supply chain issues. And then those toppers.
One of the things I see with Sharon is talking about my cats only want fish. Cats want fish. It's very addictive. And unfortunately with fish, it can be a heavy metal issue too. I see it with like hair tissue mineral analysis tests. So this is also where getting variety in so they get used to having other things is very, very important. And going along with like the toppers, people are like, well, I'm going to unbalance. Remember, your toppers are adding different vitamins and minerals and nutrients into your cat's diet. So don't be afraid to add toppers in and use that variety. So that's really important.
And, you know, I think it's super important to make sure that our cats have a balanced diet, but we also have to think, like, bringing it back to us, also mammals, how many times do you make sure that you have every single thing that you need in every meal that you eat, right? So every once in a while, if we're adding something or subtracting something, it's not gonna, if it's sporadic, especially, it's not gonna kill your cat or cause some like horrible nutritional deficiency if every single meal isn't perfectly balanced, right?
Yes.
We always promote a balanced diet, regardless of what that is, a balanced diet, but not every single meal. If this meal, the only thing that your cat will eat right now is some baby food or some tuna fish, even, you know, like don't get me
started on tuna.
I mean, not
don't feed that all the time, but
not something that you want to feed your cats all the time.
But very high value. Every now and then.
Actually, that tuna water or some tuna fish.
Yeah, what did I say? Tuna juice water.
Yes. But that's a great example of a topper. If we're really trying to like
tuna juice water. It's a trademark of mine.
Trish, do you think do you think Jay's wine is kicking in?
I think so. I think it's happening.
A little bit.
I think if Tina's here, she's probably like, uh-oh.
Danielle, thank you so much for 149 stars. Wow. That's the end of the bottle, just so you know. So
2 glasses in.
What are there only like 3.5 glasses in a we got 2 refills, so
it's all good. It's all good.
One more question, and I think this is a great question. I'm curious about your insight, because is it normal for cats to attack each other? I don't know if it's a dominance thing or if he's trying to play, but it's too rough.
What is too rough?
That is the question. Right. Exactly. So this is where, like, watching cats play. Oh my God. I don't know if I posted a reel recently of like Tico standing on Moki and like totally like people, if they watch it, like I've gotten comments like, oh my God, your cat's killing your other cat. And I'm like, no, he's not. Like they're actually like, they love each other. And it's like a crazy type of play. And that's something where normal play for a lot of cats. And this is where you have to learn what's normal for your cats. This is where we tap into watching them, assessing and seeing like, okay, things are getting a bit rough. Like they're getting like noisy, they're getting like the cat's getting really stressed, like things are like getting elevated, right? And you can tell that based on like watching them, like what are their normal behaviors, how do they normally interact with one another. And so the way cats play is pretty, like, it seems like they're attacking each other a lot of the times, like, honestly, it's intense. Yeah, and that's just normal behavior. So I would watch them as long as like they're doing okay, and if they're not hurting, they're not doing claws, they're not like bite. I mean, there can be some biting, to be honest. Like I watch my cats interact and there is some biting, and like you just watch what the other cat is doing and how they're responding to, and you're going to gain a good perspective of like, is this too much for what's going on? Right. And every cat relationship is a little bit different. Like Kiwi, our senior cat, like if you look at her the wrong way, it's too aggressive. Like, you know, if you don't like, you don't even touch her, like things are over. Whereas Moki and Tico are younger cats, like their play is actually pretty aggressive, and that's normal for them. And I had to learn that was normal for them based on just watching them.
Same. We were just live on it. Think about it, Thursday, like last week or the week before, literally live. And we hear this.
It's awful.
We both go running in the middle of the live.
We just left the live.
But we both go running, and we see that it is Friday and Zorro, and we know that they play rough and they love each other. They are a bonded pair, but they play rough. They hiss. They make this sounds, but they never hurt each other. So we saw that. We're like, it's fine. Just the Panthers.
We came back, it was just the Panthers. I do think the one thing that I want to add on top of this is the power of feline behaviorists. I think that a lot of us tend to try to like punish our cats. Like, no, you stop doing. Like cats don't respond to punishment. I think it's so important for us to better understand what our cats are saying. Like you were just saying, body language, vocalization. We need to educate ourselves about what's going on. Different dynamics. Cats are individuals, so we need to know how the dynamic between Friday and Zorro is different than a dynamic between Jack and Madison, right? So feline behaviorists, especially if anyone's finding themselves in a situation where they're seeing a behavior that they're like, ooh, I think this is a little too rough. Let's consult one. Cat Behavior Alliance is amazing. They're right here on Facebook. They're on TikTok. They're on Instagram. Feline Behavior Solutions, Dr. Marcy Koski, incredible. Consult. Like, let's learn about this, because I think that a mistake that a lot of us make is yelling. Right?
Yes.
Something's going on, and now it's like nothing was wrong, but now something's wrong because they're feeding off of our energy. Mm-hmm. Our energy is our stress or whatever.
I did that today. So I was in my office. I was on my desk. Madison jumps up. She's on the back of my chair.
Trish is dropping the links for Feline Behavior Solutions.
Thank you.
Cat Behavior Alliance. Yes. Thank you.
Madison's on the back of my chair. She is, all of a sudden I'm just like working and I'm like, hi baby. And then I'm working and then she's like, and she just starts growling. And I'm like, why?
Growling is a serious vocalization.
I see Jack down there and he's looking at her like, and she's like, and I got a video, but you can't, so I didn't post it, but she was just growling and a little bit louder and a little bit louder. And then she jumped over to the thing. Anyway, I brought her back up. All of a sudden, Jack jumps from the ground onto the back of my chair to attack her. And I hear of course,
it was loud.
Like screeching, whatever. And I belt out this loud, hey! But it's like so loud.
All the sleeping cats downstairs woke up.
Everybody in that house woke up.
That's a big shift in energy right there.
Because I vocalized immediately, like, stop, whatever that was.
It wasn't your scorpion voice, but
it's another voice.
True. Yeah. I think that we really need to take an inventory of better understanding our cats. Cat behaviorists are so helpful, especially if we think that we're dealing with an issue that's ongoing and you want it to kind of calm down a little bit. So for that, Shelby, definitely.
And what I should have done, in hindsight, what I should have done, knowing that she was really upset about Jack, is brought her to my lab because he won't get on my lap
or distracted the situation
distracted the situation, went and played whatever. I just continued working, was like, yeah, stay up here.
No. Hey, you guys, we're about 20 minutes over. We're going to do one last question tonight, which I think is a great segue into something that I want Dr. Kibble to talk about, and that is Shauna asking, the guide is awesome, but I have a pup who had some questionable kidney values last year. They have since normalized with slightly lower protein kibble, not prescription. I want her on a better diet, but I feel I need more guidance. Just wondering if the nutritional plan Dr. Katie offers would be helpful, or if I should try to schedule a consult instead. And I think this is a great segue. Thank you for that question. Because I do want people to know that Dr. Katie has a program for people that appreciate having this kind of access that can really help. It is probably the most empowering thing on the pet planet. Can you try to address Shauna's question and talk a little bit about that? We're going to close a little bit later.
Yeah. So Shauna, there's a lot of things that could be potentially going on. And so we do have a couple different options. So we have a hair tissue mineral analysis test that looks at like heavy metals, looks at vitamin mineral imbalances, and also looks at like nutrition. So you fill out like a nutritional consultation questionnaire that will show us like where things are off potentially. And also too, with like heavy metals that could be impairing the healing of your pet, but also impairing whether or not your pet's absorbing vitamins and minerals. So that's definitely an option that you can use. That's at thenaturalpetdoctor.com under our natural pet care shop and our nutritional plan. So that's definitely an option that you can use that will give you more guidance on that. What I do is I create a treatment plan, essentially like a report based on those results. Now, the other side where we actually have a lifetime program. So it's our Healthy Holistic Pet for Life Blueprint program, where for a lot of pet parents, right, this is super confusing, where there's so much information, all the knowledge, you're trying to navigate this space where, you know, you go online and you see like, okay, they're saying do this, I should do this. I don't know if what I'm doing is right. And so what we've created is we actually have our foundational blueprint program. So there are foundations for health. This is where like emotional health, gut health and nutrition, your physical health, your immune health, and environmental health. So like things like toxins are going to impact your overall pet's health. So knowing where to go, you actually have a guided program where you can learn about how everything is interrelated and what you can do and what you can implement from day one to have an impact on your cat and your dog's health throughout all the life stages. And here's the thing, and this is where people get the biggest results, is we do weekly Q&As. So you can ask questions, you can get guidance, because you know, what's more frustrating than going online and seeing something and then being like, well, how does that impact my own pet, right? So you can ask those specific pet health questions and be like, should I do this based on what my pet is going through? So there's not enough holistic vets out there. There's not enough veterinarians out there now. Like that's the problem. And so what we wanted to do is create a group setting where we can impact the most pet parents' lives as possible and support as many pet parents as possible. So this is where we all come together every single week and help guide you. And then there's also a community setting where you can ask questions throughout the week and can get guidance too. So you're never left alone. So there is a link with the Two Crazy Cat Ladies where you can schedule an interview to see if that program fits for what you're looking for. If this is something that feels like it would be important. I know that we've got some members in here, like Erin, she just mentioned, I love it. So love the personalized calls and time with Dr. Katie. This is where like everyone learns together, everyone supports everyone. I call it our family. It's not a community. Honestly, it's a family, because I literally do like happy dances when I see like the wins. I love celebrating and supporting people in our community, because I want each and every one of your pets to feel their best and live like your cats. Like I want them to live to be like 30 years old, to be honest. Like
40.
40. There we go. 40. Let's put it out there, right? So
yeah, Aaron, Madison, I know that you guys have already experienced how incredible this is. I said it at the top of this live. I'm going to say it again. I think that so many of us pet parents, we feel so frantic when we do have an issue. We go to the vet, we're trying to ask questions, we feel rushed. We're not, it's just, and that you have this whole program that you're offering to all of your clients. You do the Q&As, you have your own community, and you still come live with us, with our community for free. Think about what it would be to make an appointment with your vet. I'm just so grateful to you. I think this really opens up all of our eyes as to how much more empowered we can be and take control of our pets' lives. And I know that's what fuels you, are those happy dance moments of, wow, this is, is it the emotional pillar of health? Is it the immune pillar? Where can we go? What's the answer here? And how does it all work together? Thank you so much once again for spending your amazing time with us, your incredible knowledge. We're so grateful. I just love you so much.
We really are.
Oh, well, I love this. And I love you beautiful ladies for creating this sacred space so cat parents can learn more. And honestly, we're all in the same mission. Every single one of us, every single cat parent that's here, we want our cats to live the longest that they can and most vibrant and healthiest life that they can. And honestly, if I can impart a little bit of knowledge to help them, that is my mission in my life. That fills me up. And I'm so blessed to be able to come on here, and I appreciate you bringing me on so that I can help people.
Well, and you do it every day.
And our VP of Life just put a pin in it. She just dropped that the guide for Dr. Katie.
Yes, get the guide. It's free.
It is free, you guys.
It's free.
This is the kind of thing that a lot of people will be paying $300 for. Honestly, I think. I mean, where people have those hey, download whatever, and it only costs. This is free, you guys. Please go get it. It is going to enlighten you in some way. Trish just dropped the link. Go download the free guide. It is really incredible. Thank you so much, Dr. Katie. Once again, I hope that we can meet again next month, all COVID free as well.
Yeah, we're staying COVID free. We got antibodies now. This is our immune system working.
Let's go. Let's go.
All right. All right. We love you so much, Dr. Woodley. Thank you for joining us. And we love you guys for joining us tonight. We will see you again tomorrow for Think About It Thursday at 2 o'clock. And then our podcast at 2:30. Pacific
Good night,
time.
you guys. Happy Wednesday.
Bye, guys.